These health insurance companies had to have known from a PR standpoint that raising premiums was going to be a negative on them, yet they did it anyway. Is there a backstory? What is their reasoning for raising premiums in the middle of this political environment?
Oh, they're going to continue to raise it because they have the ability to. Whether the government steps in or, as we said before, the employers step in, the doctors can't hold them accountable. The employers paying them can't hold them accountable. I seriously doubt the government is going to be able to. And I think what we just heard is, yes, he is addressing the middle class. But what the president failed to say today is that, yeah, it's important that we get insurance and eliminate this whole issue of pre-existing conditions. But it's not a reality to say that we're going to address it in this year. And those same people that stood behind him probably don't understand that they're going to pay for this for the rest of a lifetime, because the math for which the president is using to pay for this hasn't been figured out yet. And there simply isn't a plan that's deficit neutral where those unfortunate young college students behind them who are smiling away fail to recognize they're going to be paying for this bill for the rest of their lives and probably a lot more.
Doctor, the president today once again going after health insurance companies. Just 6 months ago, they were all meeting in the White House trying to come to common ground, working together. Do you think that the health insurance industry can come back to the table with the president? And do we need to once again have the discussion about opening state-to-state lines and competition across state lines?
The health insurers won't come back to the table unless there's a mandate that's on the table, which means that there's a public option. That's the only way they can make up for any control on their premiums.
Because they make more money if there's a public option. That helps them even more with profits.
Yeah, and the Goldman Sachs study that Secretary Sebelius and the president alluded to, where they looked at the EPS, the earnings per share, and the stock valuations, is mandated on how these insurance companies are making money off of their float. They make money the more they sit on money. So if they're going to sit on money, they're certainly not going to pay it out.
Doctor, call me naive, and maybe you've heard this question 1,000 times, but should we still be talking about tort reform, or just should we put that in the past?
Yes, of course we should. We should be talking about tort reform so that you limit the amount of damages that are incurred. We get physicians out of the practice of practicing defensive medicine and doing what they need to do. It's important in the bigger picture of things, along with the other things. So yeah, we shouldn't ignore it at all.
Well, in the end, is this going to get done? Jerry, you say maybe by Easter, but not in the next 10 days. Sreedhar, what do you think?
I don't think it can get done in the next 10 days. And I'll tell you one reason why is one of the local medical centers on Monday is bringing together all of the leading physicians in the Washington area to come and ask the tough questions about what's going to happen to health care and ask the lawmakers to come. So I think there's a lot of skepticism in the medical community about how this is actually going to work. Peter Orszag and Nancy Ann DeParle seem to think that the math works and that quality is going to be maintained. A lot of skepticism in the medical community. I think the jury's still out, and I think getting it done before the 18th is going to be hard.